I've been a physician for over 20 years, and I still remember the moment a patient, a man in his late 60s, married 34 years, sat across from me in my office and said, "Doc, I feel like I don't even know her anymore. Like something happens between us and I can't read it. I can't tell if she's with me or somewhere else entirely." And I told him what I'm about to tell you. The female body during intimacy is not silent. It's speaking constantly. And most men, even good men, attentive men, men who love their partners deeply, have no idea what's being said. I'm Dr. Ava Remington. I've spent more than 2 decades working in sexual health and couples medicine. And today I want to walk you through something that doesn't get discussed nearly enough in plain, honest language, not in a clinical textbook way, not in some vague, overly sanitized way, but real, grounded. The kind of conversation you should have been able to have with a doctor years ago, but probably never did. Because here's the truth. The female body during sex does things that have nothing to do with what you see in movies, nothing to do with what you think you know, and everything to do with a deeply complex neurological and biochemical system that most men have never been taught to recognize. And once you understand it, you cannot unsee it. You will look at intimacy differently. You will understand your partner differently. And if you're a man who's been feeling disconnected from your wife, from your long-term partner, from that sense of real closeness, what I'm about to share may genuinely change something for you. So let's start at the beginning. Let's start with something small, something most people would never even notice. The toes. I know, sounds strange, but stay with me here, because this is one of the most fascinating involuntary responses the female body produces, and it happens in a very specific moment. When a woman reaches orgasm, not approaches it, but actually reaches it, a significant number of women experience what we call a microtremor in the extremities, specifically in the toes and sometimes the fingers. It's not a dramatic shake. It's not something you'd see from across the room. It's subtle, a tiny, rapid, involuntary contraction. What's happening is this. The brain's sexual response activates nerve pathways that extend all the way to the body's periphery. The nervous system, overwhelmed by the intensity of the moment, essentially needs to release excess neurological energy, and it does that through the extremities. The toes curl slightly, tremble for a fraction of a second, and then relax. Most men never notice this. They're focused on other things, and understandably. But the men who do notice it, who understand what it means, have a completely different level of awareness about what's actually happening in their partner's body. Now here's where it gets even more interesting. A few seconds, sometimes just 2 or 3 seconds, before a woman reaches that peak, something happens in her eyes. Her pupils dilate, noticeably. Even in normal lighting conditions, if you're close enough and paying attention, you can see it. This is not romantic poetry. This is hard neuroscience. What's happening in those moments is that the prefrontal cortex, the part of the brain responsible for judgment, logic, planning, social awareness, begins to go quiet. Researchers have actually documented this using neuroimaging. The activity in those regions drops significantly during female orgasm. What that means in plain English is this. In that moment, she is not thinking. She is not evaluating. She is not self-conscious. She's not worrying about the kids, the mortgage, the argument you had last Tuesday. All of that goes offline. What remains is pure sensation, pure presence, pure biological response. And her pupils, those widening, darkening pupils, are the visible signal of that shift. Now, I need you to really hear what I'm about to say, because this next part surprises people more than almost anything else I share in my practice. And yet, it is completely medically documented. Some women cry after orgasm. Not sometimes, not rarely. This happens to a meaningful percentage of women, and yet most of them have never told their partner. Most of their partners, when it happens, panic. They think something went wrong. They think she's upset. They pull back, they apologize, they ask, "What's the matter?" And in doing so, they interrupt one of the most profound moments of vulnerability a woman can experience. Here's what's actually happening. During sexual arousal, and especially at orgasm, the brain releases a significant neurochemical cascade. Dopamine, your reward and pleasure chemical. Oxytocin, the bonding hormone, sometimes called the love hormone. serotonin, mood regulation, prolactin, which actually creates a feeling of satisfaction and emotional fulfillment. All of these are released in a very short window of time. For some women, that's just too much for the body to process emotionally. The system gets flooded, and the release valve, the way the body discharges that emotional overload, is tears. These are not tears of sadness. They are not tears of pain. They are the body's way of saying, this was real, this was significant, this touched something deep. Postcoital dysphoria, as it's sometimes called in clinical literature, is actually distinct from this. That's a different phenomenon. What I'm describing here is post-orgasmic emotional release, and it is fundamentally positive. It means something meaningful happened. If you've ever had a partner cry after sex and you didn't know what to do, now you know. The right response is not to back away. It is to hold her, to be still, to let her body complete its process without making her feel like she needs to explain herself. That kind of response, calm, present, non-reactive, is one of the most intimate things a man can offer. Now let me tell you about something that very few men know exists, and even fewer know how to feel. There is a small muscle group in the pelvic floor called the pubococcygeus muscle. You may have heard it mentioned in the context of Kegel exercises. And yes, women do those exercises to strengthen this exact muscle group. During orgasm, this muscle contracts involuntarily, rhythmically, multiple times. These contractions are not performance. They are not something a woman consciously controls or produces. They are a direct, involuntary output of the orgasmic reflex, driven entirely by the autonomic nervous system. Men who are attuned to this, who understand what they're feeling when it happens, experience something profound. Because what you're feeling in that moment is not just physical contact. You are feeling her nervous system respond. You are feeling her body do something it does entirely on its own, entirely beyond her control, entirely because of what is happening between you. That's not a small thing. That's intimacy at a biological level. Now, I want to talk about something that goes beyond the moment of orgasm itself, something that happens in the minutes and hours after, because this is where I see the biggest gap in most men's understanding, and honestly, in most relationship health. After sex, after real intimacy, not just physical contact, the neurochemical environment in both partners changes, but it changes differently. And understanding those differences can transform how you navigate the time after sex, which is actually one of the most important windows in a long-term relationship. For women, the post-sex period is often when oxytocin levels are at their peak. Oxytocin drives bonding behavior. It creates a desire for closeness, for eye contact, for physical proximity. It makes her brain associate this person, you, with safety, with warmth, with emotional security. Here's what a lot of men don't realize. The way you behave in the 20 minutes after sex has a disproportionate impact on how your partner feels about the relationship overall, more than the sex itself, in many cases. Rolling over and falling asleep immediately doesn't just feel dismissive to her. Biochemically, it cuts off the oxytocin bonding window at exactly the moment when it's most active. You're essentially walking away from the most powerful natural bonding opportunity your relationship has. I'm not saying you need to stay awake for hours. I'm saying 20 minutes, eye contact, a hand on her back, staying present. That's it. That window matters enormously. And here's something I tell my older male patients specifically, because this becomes more relevant with age and with long relationships. Emotional attunement during and after sex is not just good for your relationship. It's good for your health. Men in emotionally connected relationships have lower cortisol levels, better cardiovascular outcomes, stronger immune function, and significantly lower rates of depression and cognitive decline. This is not correlation. There is substantial research pointing toward causation. Closeness keeps you healthier. Physical intimacy that includes emotional presence keeps you sharper. The men I see in their 70s and 80s who are most vital, most cognitively intact, most satisfied with their lives, they almost universally describe a deep sense of connection with their partners, not just physical, emotional, present. Now, let me address something practical, because I've been practicing medicine long enough to know that people respond to concrete information. I've shared a lot about what the female body does, but I want to be clear about the other side of this equation. What affects the quality of your own physical presence in these moments? Your body is part of this exchange, and the quality of that exchange is directly tied to your overall health. This is not complicated, but most men have never had it framed this way. Sleep is probably the single most underestimated factor in sexual health for men over 50. During deep sleep, your body produces the majority of its daily testosterone. Consistently poor sleep, less than 6 hours, fragmented sleep, sleep apnea that's gone undiagnosed, can suppress testosterone significantly, not just your libido, your presence, your energy, your ability to be emotionally available. All of it is downstream of sleep quality. Chronic stress is the second factor. I cannot tell you how many men I've seen over the years who describe a gradual withdrawal from intimacy that they attribute to just getting older. And when we dig in, it turns out their cortisol has been chronically elevated for years from work stress, financial pressure, unresolved conflict. Cortisol and testosterone have an inverse relationship. High cortisol suppresses testosterone. This is a physiology, not weakness. Diet matters too, though probably not in the ways you've been told. The biggest dietary factors for male sexual health are not exotic supplements or special foods. They are the basics: reducing processed food, reducing sugar, increasing vegetables, particularly those with high antioxidant content like berries, tomatoes, and leafy greens, and staying well hydrated. These things affect circulation, inflammation, and hormonal balance in ways that are directly relevant to your physical and emotional vitality. Physical activity, even moderate, consistent activity like walking 30 minutes a day, has been shown in multiple studies to improve testosterone levels, reduce erectile dysfunction, and improve overall mood and energy in men over 60. The cardiovascular benefits alone are significant, but the hormonal and psychological effects are equally important. I want to be really straightforward with you about something, because I've been around long enough to say it plainly. A lot of men come to me, or come to their own doctors, and frame their concerns about intimacy purely in physical terms: performance, function, the mechanical side of things. And yes, those matter, and those are real concerns that deserve real medical attention. But the men who make the most meaningful improvements in their intimate lives are almost never the ones who only address the physical side. The men who report the deepest satisfaction in their 60s, their 70s, their 80s are the ones who also did the other work, who learned to pay attention, who learned to be present, who stopped treating intimacy as a performance and started treating it as a conversation, one that involves not just words, not just bodies, but everything I've been describing today. The pupils, the tremor in the toes, the tears that don't need explaining, the muscle that speaks when words can't, the 20 minutes after that says more than 2 hours before. This is the stuff that doesn't come up at your annual checkup. This is the stuff that nobody sat you down and explained when you were younger. And honestly, that's a failure of how we talk about men's health in this country. We focus on cholesterol panels and prostate screenings. And those matter, don't get me wrong. But nobody talks about emotional attunement as a health metric. Nobody talks about the quality of post-sex presence as a predictor of relationship longevity. Nobody talks about what it means to actually understand your partner's body at a neurological level. That's what I want to change in my practice and in conversations like this one. Because the man who understands what's happening in his partner's body, who recognizes the pupil dilation, who doesn't panic at the tears, who can feel the difference between a connected moment and a disconnected one, who stays present in that 20-minute window after, that man has something that no pill, no supplement, no procedure can provide. He has knowledge, and he has presence. And in a long-term relationship, those two things are more powerful than almost anything else. I get asked all the time by patients, at my age, is it too late to change things? Is it too late to get back to something that feels real? And my answer every single time is no, it is not too late. I have seen men in their late 60s completely transform their marriages by doing nothing more than becoming more attentive, by learning what to look for, by staying in the room emotionally after the physical moment ends, by understanding that what their wives needed was not a different man, but a more present version of the man they already had. I have seen men who had gone years, sometimes a decade or more, with a sense of distance in their relationship, find their way back to genuine closeness. Not through grand gestures, not through expensive vacations or couples therapy alone, but through the small, consistent, informed choices that say, I am paying attention. I am here. I see you. That is what all of this comes down to. The science I've shared today isn't just interesting information. It's a roadmap. The toes, the pupils, the tears, the muscle that contracts involuntarily, the 20-minute window. Each of these is a point of connection. Each of them is a moment where you can be more present, more aware, more genuinely there for the person you've chosen to be with. And for the men watching this who are thinking about a specific person right now, your wife, your partner, someone you've been with for years, or someone you're hoping to build something real with, I want to leave you with this. She is communicating with you constantly. Her body is sending signals you may not have had the language to read before today. Now you have some of that language. Use it. Stay curious. Stay present. And if any of this raised questions about your own health, your own relationship, your own biology, talk to your doctor. A real conversation with a physician who takes these things seriously can change a lot more than you might expect. I've seen it happen more times than I can count, and I'd love to hear from you. What part of this surprised you most? Drop it in the comments. I read them, and your questions help shape what I cover next.